Welcome to AM News. My name is Denisia Pomaiji. Investigative journalist Erastus Asare-Donkor has issued a stark warning that Ghana is accelerating toward ecological collapse as the country's forest loss reaches what he describes as catastrophic and historically unprecedented levels. According to him, Ghana once had about 6.5 million hectares of primary forest since the 1900s. The following report has more.
Investigative journalist Erastus Asare-Donkor has revealed that the most brutal wave of forest destruction has occurred in just the last decade when a flood of heavy machinery, foreign-backed operators and illegal miners invaded forest reserves to mine gold. Speaking as a keynote speaker at CDD Ghana's 20th Krontine Akwemu lecture, Erastus Donkor warned that without immediate aggressive national action, Ghana risks irreparable damage to water security, collapsing river systems, unpredictable rainfall, and long-term threats to agriculture and food production.
As of the year 1900, Ghana had a closed or primary forest covering an area of about 6,500,000 hectares. By the year 2000, this figure had reduced to 4,200,000 hectares. This has been widely attributed to the 1982-1983 wildfires that hit the country. Between the year 2000 and 2015, Ghana's primary forest reduced to 1,450,000 hectares. And this was the period that Ghana moved into artisanal mining using simple to medium implements or tools. However, from 2015 to 2024, the country lost a whopping 430,000 hectares of its closed primary forest, bringing Ghana's entire closed forest space to just 1,020,000 hectares. During this period, the country transitioned very fast from the use of simple tools in artisanal mining to the use of heavy earth-moving equipment in small-scale mining.
Australia's High Commissioner to Ghana, Bernice Owen-Jones, described illegal mining as a national crisis requiring urgent collective action.
I see illegal mining as very much a national security issue. The Mining for Peace project has taken a thoughtful, community-centered approach through research, dialogue, and new practical skills training. The project has engaged directly with mining communities. Again, this is key. And I was delighted that the initial findings were presented at the Australian High Commission's West Africa Mining Security Conference in 2024. And in terms of practical outcomes, the project is providing livelihood skills for youth in 10 mining communities across 5 regions in Ghana.
Former Environment Minister Professor Frimpong Boateng warned that Ghana is destroying natural resources with far greater value than the gold fueling illegal mining.
For me, as a doctor, as a scientist, when I hear that because of $8 or $10 billion, the environment has to be destroyed, it's a pity. You also see, the trees are the most prominent things in the forest or in the farmlands. But there are certain things that are more important than trees. There are so many things that we can find in our forest that can give us more money than what you are gaining from gold. But the gold is there. It has to be mined sustainably and with respect for the environment.
The various speakers called for urgent reforms, strict enforcement, and partnership across civil society, government, and communities and international allies to save Ghana's remaining forests, protect rivers, and restore environmental integrity before it is too late.
Fresh data from 2024 reveals a worrying spike in teenage pregnancies in the Central Region, with more than 7,100 girls becoming pregnant, including 420 children aged between 10 and 15. Expressing deep concern, the regional director of the Department of Gender, Richlove Amamu, said the figures point to an alarming rise in defilement cases. There's more in the following report.
The Central Regional Department of Gender marked the 2025 16 days of activism against gender-based violence in collaboration with GPRTU and Cape Coast. The regional director of the department, Richlav Amamo, noted an alarming 2024 recorded data revealing that 420 girls between 10 and 15 years got pregnant in that year in the region, and stressed the need for sensitizing the drivers and engaging GPRTU.
If 420 girls below 16 years got pregnant in 2024 alone, then you should know Central Region, we have a lot of work to do. I also advised the drivers to protect women and girls, because there was a time I met drivers at a Kumfi. When I was having the interaction with them, someone said, sometimes you pick the student, you know, they are going to school, but along the line, you get to a point and the students will say they want to alight there. You can see that they are not going to school, they are going to visit maybe their boyfriends or something. So I told them to protect the children as well. And sometimes if you see a man boarding the car with a young lady, you can question the man. Where are you sending the girl to? These are things they can also do. And because we want to engage the men, to educate them on the position of the law so that they can end all forms of violence against women and girls in the Central Region, engaging GPRTU was a laudable initiative that started with UNFPA. So we are happy we met them.
Alex Mustafa, the Senior Industrial Relations Officer of GPRTU in the region, affirmed their commitment to fight gender-based violence.
Yes, you see, unlike those days whereby you beat your wife by heart or arbitrarily. Yesterday, it was a new program together that has changed the habits or the attitude of drivers towards their wives or towards their husbands. Going forward, they have given us the message here. And it is left for us also to send the message outside, even to our family setup. And when drivers go everywhere, they try to champion that cause. So the way forward, the drivers have accepted the challenge, and from today going, you will see that they will be sending the message to those drivers who were not here, those porters who were not here, and all those who were supposed to be here and they were not here. The message will get down to them.
From Cape Coast, Abigail Lesal and Nkrumah reports for JoyNews.
Let's stay a while longer in Cape Coast because the chairman of the Governing Council of the Cape Coast Technical University, Professor Isaac Kwame Dontwi, is calling on Ghana's academic community to refocus their research efforts toward addressing the country's pressing developmental needs. Speaking at a public lecture in the launch of a research report at the university, Professor Dontwi emphasized that research must transcend theoretical publications and translate into practical solutions that advance national progress.
The Cape Coast Technical University is 40 years old. During a public lecture and launching of research reports, which formed part of the anniversary celebrations, the Vice-Chancellor, Professor Kweku Educhumeyi Mwache, described the essence of research.
As a University of Applied Sciences, research is not just an academic requirement. It is the foundation upon which we build practical solutions for industrial transformation. The report we are launching today, the first ever of its kind, displays the burgeoning research culture that this great institution possesses. It reflects months of rigorous inquiry, collaboration, and dedication by our faculty and research teams. Their work demonstrates the relevance of technical and vocational education in responding to the needs of industry, communities, and the broader socioeconomic environment. This achievement notwithstanding, management is even undertaking more interventions to boost the research culture of the university and enhance its international image.
The chairman of the Governing Council of the university, Professor Isaac Kwame Dontwi, urged the university to conduct research that influence national agenda.
Let's make sure that the research that we're doing would affect, impact, and direct national activities first and foremost. And therefore, I'm just entreating management, and I've said this several, that we need to reshaping the way we judge our publications for promotion. We cannot remain, just making sure that we are publishing in Scopus and we are happy. No. That which can be published in Scopus can have an impact as a technical university if we redirect the way we do things.
Director of Drake, Professor Richard Osai, noted the progress of the institutional research agenda and research award scheme.
The university leadership, the governing council, the vice chancellor, pro-vice chancellor, registrar, and director of research innovation reaffirmed their commitments and promoting innovation and technology transfer. As part of the university research development plan, we are in the advanced stage of finalizing both the institutional research agenda and the research award scheme. These initiatives will be released soon, and together they will strengthen the quality of our research enterprise and provide well-deserved recognition to outstanding researchers within our university.
From Cape Coast, Abigail Lissel in Nkrumah reports for JoyNews.
From the Central Region, let me take you to the Upper West Region. Outgoing National Chairman of the Nurse and Midwife Educators Society, Matthew Adamu, says simply producing large numbers of diploma and certificate level nurses and midwives is inadequate to meet the country's growing healthcare needs. He argues that the focus should shift to specialized training programs that equip practitioners to tackle emerging medical challenges. He made the remarks at the Society's National Quadrennial Congress in Wa. JoyNews' Upper West Region correspondent Rafiq Salam reports.
The Quadrennial National Congress of the Nurse and Midwife Educators Society was held on the theme Research and Innovative Mentorship in Tertiary Education, the role of faculty in health training institutions. The Congress brought together delegates from all parts of the country to deliberate on key issues affecting the society in the past, strategizing for the succeeding years. National Chairman of the Nurse and Midwife Educators Society, Matthew Adamu Buckingham, averred that the mass production of diploma and certificate nurses and midwives are counterproductive, calling for a paradigm shift, refocusing the training to prioritizing specialization on courses that are relevant.
How comfortable are we when a nurse is attending to us? If we are not fully comfortable, then we must rethink and innovative in health training by prioritizing specialization and quality assurance rather than the mass production of diploma and certificates program or certificate nurses. We cannot continue to overproduce general nurses and midwives. We must refocus our training towards specialization, relevance, and quality.
The Delegates Conference serves as a swan song of Matthew Adamu Buckingham, and he used the opportunity to raise earlier concerns by the society, urging the government to address them quickly.
The urgent need to convert all the health ATIs into fully tertiary according to international status. We have to get the full, but schools must be migrated to full tertiary status to meet the international standard. Implementation of the developed, I repeat, developed conditions of cells. We have harmonized status and harmonized condition of cells. It needs to be implemented. Again, we want readjustments of all the internal allowances. We have marking allowance, supervision allowances, labor ward assessments, and project works. We need to readjust all these things. Now, our research and book allowance is long overdue. It has been negotiated and we are waiting for implementation. We've done the costing and we know that very soon we need to hear good news from the Minister or Concurrent Accountant General.
Health Minister Kwabena Mensah Akando, in a speech read on his behalf by Deputy Director, Health Training Institutions at the Ministry of Health, Rebecca Akole, stated that government was aware of the need for higher education at the various nursing colleges. As a result of that, plans are afoot to upgrade 41 nursing training colleges in the country to degree awarding institutions.
We have completed the assessment process and are going through accreditation process to commence the programs. To bridge the gap in critical care service delivery, the government is beginning with specialization programs from readily selected colleges, including emergency, critical care, cardiology, nephrology, and oncology nursing.
Also lays in the speech of the health minister is the mass exodus of health professionals, particularly specialist nurses, to high-income countries.
For this reason, the government has put in place some bilateral agreements with other countries to at least manage the exodus and ensure that our nurses travel under dignified conditions where both the nation and individual nurses will benefit.
Reporting for JoyNews, Rafiq Salam.
Away from the Upper West region, burning of waste is quietly undoing Ghana's progress in the fight against air pollution. New research shows that while emissions from transport and household fuel have steady or even improved, waste burning is now driving dangerous spikes in pollutants across major cities. Today, experts, policymakers and clean air advocates gathered at the Breathe Accra National Stakeholder Convening, warning that Ghana risks losing decades of gains if waste burning is not urgently tackled. There's more in the following report.
Over 2 million gasoline cars inch through Accra streets every day, releasing clouds of pollutants from the air. Their impact on the city's air quality has been significant, but for 2 decades, transport emissions have stayed largely the same.
What we have found out is that the proportion that is coming from traffic remains the same. It hasn't changed over the last 20 years.
That's Dr. Raphael Aku, Associate Professor of Environmental Health Sciences at the University of Massachusetts. He and his team have spent 20 years sampling particulate matter across key communities, studying the fingerprints of pollution.
But the good news is that we have also found that the one that is coming from biomass burning, like when we burn wood for cooking or fish smoking or charcoal, that part has reduced significantly.
Policies like the ban on old vehicle imports and the new emissions levy were expected to further cut pollution from transport, but the emissions levy fell short of its goals. Dan Westerveld, a research professor at Columbia University, analyzed the data.
And we did not see any PM 2.5 change between the post-levy period and the pre-levy period. Basically, there were some changes, but statistically insignificant changes, very, very tiny, like a fraction of a % change in air pollution due to the policy.
Despite gains in cleaner cooking fuels, Dr. Aku warns that a new threat is wiping those gains out: waste burning.
We are also not doing well in trash collection, so people are now burning the trash. So it's making up for the gains that we make in biomass burning is being made up for in waste burning. So that means we are not making much progress anymore.
Part of the challenge is the lack of safe alternatives for moving around the city. Cycle lanes are rare, and where they exist, traders often take over the space. The Director for Planning and Programs at the National Road Safety Authority, Martin Afram, says change is critical.
The key thing is that we want to mainstream the provision of bicycle lanes and pedestrian walkways into the road infrastructure. And this is well spelled out in the National Transport Policy.
Dr. Aku's work forms part of the Breathe Accra initiative, a coalition pushing for cleaner, healthier air. Speaking at the gathering, Portfolio Manager Dr. Elvis Jabo said the next phase is mainstreaming.
We are hoping we can see some more mainstreaming and then build more on the awareness and also the capacity to implement these policies, because it's good to know that we've done an air quality action plan, but do the people know how to implement it? So we're hoping to build on the work we've done, the foundation we've laid, and see how things can scale off to even be able to create more impact and get more results at the end of the day.
Technical head for Breathe Cities Africa, Seneka Naidu, applauded Accra for leading coordinated action across 13 districts.
Now you've got those in 13 different districts. That's a lot of people to come together to make sure that you move this work forward. And the fact that that the city has been able to do that, I think is really, really a great achievement. So I think that's something that we want to see a lot more.
Ghana has made real progress. Cleaner cooking fuels, steady transport emissions, and coordinated policy workout. But the rise in waste burning threatens to undo it all. As experts warn, cleaner air is possible, but only if enforcement, waste management, and the public behavior change move as one. This story was a collaboration with New Narratives. Funding was provided by the Clean Air Fund, which had no say in the story's content. For JoyNews, Michael Ashali.
And that's it. We'll bring you business news now with, of course, Samuel Kujibrace.
Let's do business updates now. And economist Professor Peter Kote has urged commercial banks to match the Bank of Ghana's policy rate cut to 18% with a corresponding reduction in lending rate, stressing that this will ease access to credit and help businesses remain afloat. Speaking to Joy Business, he warned that without swift action, the intended benefit of the policy rate reduction may not reach the private sector.
The decline, the reduction in the policy rate has to trickle down to lending rates. Although sometimes we have the stickiness downwards, we don't get an equal percentage decline in the lending rates anytime the policy rates are reduced. But one could also understand that we have such a high default rate in the system. I mean, if the NPLs are in the range of about 20% on average, banks, when they lend, would have to cover their costs and also be able to satisfy depositors. So we also have to work on the default rates. But overall, the decline will certainly trickle down to the banks. Lending rates will come down, and that can help borrowers or investors borrow more and invest and be able to grow their businesses. And in total, on the aggregate, we should see this translated into economic growth or GDP growth rate.
Away from that, the United Nations Development Programme, UNDP, is supporting micro, small and medium enterprises, MSMEs, to access the market of the African Continental Free Trade Area. The move is geared towards elevating these businesses from their status to be global giant. UNDP resident representative in Ghana, Neloy Banaji, has been speaking to Joy Business after opening a national stakeholder dialogue on the implementation of the AFTA protocol on women and youth.
There is a need to understand what is the regulatory environment, what is the policy environment, and then what are the agencies and institutions of government that you can go to for your grievance redressal or for harassment of our women and youth entrepreneurs who are trying to do cross-border trade. What are the mechanisms available to you? But also looking at how to access concessional capital, how to access marketing facilities. You know, one of the problems is we are weak on marketing. We are not doing. We're not getting enough support on issues like packaging, quality assurance. How does it become internationally acceptable standards? So that's that's an area where UNDP can support, because we are aware of other good practices that are happening. If you're listening to the presentation that's going on right now, there are good practices from Rwanda and Kenya being shared with participants here, and with a strong recommendation that some of these can be adopted quite easily without much cost or effort.
That's all in Business Update. Back to you, Denisha.
Thank you, Ahanta Pili, Samuel Kujibris. And that's it for AM News. For more news, please log on to myjoyonline.com. Up next is sports.